Today, we're diving into one of the biggest revolutions in modern cardiology. It's a procedure that is literally changing the game for how we treat failing heart valves, and it's offering brand new hope to thousands of people. I mean, just think about that for a second. A major, life-saving heart repair, but without cracking open the chest, without even stopping the heart. It sounds like something out of a sci-fi movie, right? Well, it's the reality that's reshaping cardiac care as we speak. So to really get why this is such a huge deal, we first have to understand the incredibly tough spot that many patients with a diseased aortic valve used to find themselves in. For a long, long time, the only real fix was a full-blown open heart operation. And look, it works, but it's a massive physical ordeal. For patients who were older or already dealing with other health problems, the risk of a surgery that invasive was often just too high. It left them with very few, if any, good options. But then, everything started to change with the arrival of a revolutionary new approach. And this, right here, is where our story really gets interesting. It's called Tavi, that's T-A-V-I, which stands for transcatheter aortic valve implantation. And honestly, the name pretty much tells you everything you need to know. A new valve is delivered through a catheter, which means you can skip the traditional surgery altogether. It's a truly elegant solution to a super complex problem. And this chart just lays it all out so clearly. On one hand, you've got open chest surgery, where they literally have to stop your heart. On the other, you have a catheter-based procedure where the heart just keeps on beating. The difference in recovery time, as you can probably guess, is just night and day.
If you'd like to support my project, you can offer me a symbolic coffee on Ko-Fi. You'll find the link below in the description. You can also check out my book, where I've gathered many experiences and useful tips. Every gesture means a lot to me and truly helps me keep this channel and the whole project going. And if you haven't done it yet, I invite you to subscribe to the channel, turn on the notification bell, and visit my website or blog for more content. Thank you from the bottom of my heart.
Okay, so how does this miracle of modern medicine actually work? Let's break it down. You might be surprised at just how clever and straightforward it is. First things first, the whole thing is incredibly quick. We're talking just 1 to 2 hours, typically. To put that in perspective, that is a tiny fraction of the time it takes for a conventional open heart surgery. So here's the play-by-play. First, the patient is just sedated, not put under with general anesthesia. Then, this thin tube, the catheter, is inserted, usually through an artery in the leg, and gets threaded all the way up to the heart. Packed inside is the new valve, all folded up. Once it's in the perfect spot, the doctor deploys it. It expands, pushing the old diseased valve out of the way. Then they just pull the catheter out. It's an incredibly precise, elegant, and minimally invasive process. Of course, with a procedure this groundbreaking, you're probably asking, okay, so is it for everyone? And that's a great question. The answer is nuanced, and the decision is made with a ton of care. Yeah, it is definitely not a one-size-fits-all kind of deal. A special heart team made up of cardiologists, surgeons, and other specialists gets together to look at each patient's unique situation. They look at absolutely everything: age, overall health, any other illnesses, and even the specific anatomy of the person's heart and blood vessels. And this right here really shows you how much things have changed. Tavi used to be reserved for only the highest risk patients, the ones who had no other options. But now, it's become the standard of care. For most patients over 75, it's the go-to procedure. And that's because years of solid clinical trials have proven it leads to fantastic outcomes and a way, way faster recovery. That's a fundamental shift, a complete 180 in how we approach heart valve disease. All right, but let's be real. Like any medical procedure, there are trade-offs. It's super important to have a balanced view, so let's take a look at both the good and the not so good. The advantages are clear and they are powerful. It's way less invasive, the recovery is dramatically faster, and you're only in the hospital for a few days. But on the flip side, the new valve is biological, which means it has a limited lifespan. Think somewhere between 8 and 15 years. This means it might need to be replaced again someday, which is a big reason why it's less common for younger patients. There's also a risk of needing a pacemaker, among other potential complications. Let's put a number on that pacemaker risk. The data shows that about 10 to 20% of patients, so an average of 15%, like you see here, might need a permanent pacemaker afterward to keep their heart rhythm steady. For the other 85%, it's a non-issue. It's just one more key factor that the heart team weighs in their decision. So after a successful procedure, what's the journey look like? This, to me, is maybe the most compelling part of the whole Tavi story, the incredibly quick return to a normal life. And this timeline says it all, doesn't it? Patients are often up and walking around within a single day. They're heading home from the hospital in just 2 to 4 days, and within a week or two, they're getting back to their daily routines. It's a completely different world from the months-long recovery of traditional surgery. It's just, wow. But, and this is a really important but, the journey isn't over when you walk out of the hospital. Long-term success really hinges on consistent follow-up care. Regular checkups with your cardiologist are absolutely essential to monitor the new valve and make sure it's working perfectly for years to come. You know, when you step back, Tavi has completely rewritten the rulebook for aortic valve replacement in just a couple of decades. It really makes you wonder, doesn't it? If this is what we can do now, what other seemingly impossible breakthroughs in heart medicine are waiting just around the corner? What will the next 10 years bring?